Insomnia is a really common experience during pregnancy. In fact, up to 73% of people report insomnia during pregnancy, and 78% of people have it at least in the third trimester. So it's a really common thing. And sometimes people will use what we call the Z drugs for treatment of insomnia. And we wanted to talk to you today about the known risks of using those medications during pregnancy. I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
So what are the Z drugs? Essentially, they're sleep medications, and I think they're Z's because it's a little titchy thing about Z's or sleep, right?
Oh, I thought it was because they all contain the letter Z.
I think they do contain the letter Z because it's this kitschy Z's for sleep thing.
Oh.
Maybe. I don't know. They have a Z in their name, so there's I can't say it. Eszopiclone. Zaleplon and Zolpidem.
Zolpidem's the easy one.
Zolpidem and Zaleplon, I feel like, are easier to say than Eszopiclone. Who came up with that name?
Well, not me.
Okay, moving on. Okay, we're talking about real stuff here, I promise.
Yeah.
Okay, insomnia is very common in pregnancy, so we know that the treatment of choice is cognitive behavioral therapy for insomnia, but sometimes that's not right for everyone, and we need to utilize a Z drug. And so we wanted to talk to you about the known risks of doing that. I wanted to read a direct quote from an article that is a 2020 article from Macaro. Sleep is likely both an outcome and a predictor of increased level of stress during pregnancy, which may be linked to a cascade of negative consequences for the birth, the mother, and the child. So there's a really complicated relationship between sleep and stress and outcomes. So I just want to point that out.
Yeah, and we've talked about this kind of before too, in that sleep and mental health go together. They can influence each other, and so that's what we're seeing in pregnancy too.
Right.
So if somebody has taken one of these Z drugs up to 90 days before they get pregnant, their pregnancy is at an increased risk of miscarriage and ectopic pregnancies. And that's for the class as a whole, so not looking at specifically individual medications. Another study done in 2011 also looked at the class as a whole and kind of looking at the risks of these medications, and included over 1,300 people and found that there was a small increased risk of intestinal malformations, so GI malformations in the babies. But this was complicated because people were on polypharmacy, meaning they were on multiple other medications. They also didn't look specifically at the different types of Z drugs, and they didn't look at, what's the other thing? Oh, they didn't look at how frequently the medication was taken. So we don't have it's not a great study or indicator, but it did show an increased risk of those intestinal malformations.
I mean, can't you imagine a scenario where someone takes the medicine one time and then they have insomnia for the rest of their pregnancy? They go in that category of having taken the medication and they're at increased risk of intestinal malformations, but maybe it was just the insomnia.
Yeah.
We don't know. So I just want to kind of give an example of how you can see the nuances here aren't really teased out. So yes, we did find an increased risk of intestinal malformations, but that study is relatively small, and it's not that it was a bad study, it's just that there's a lot of other things that we could be looking at there.
Yeah, it wasn't a well-done study, and then it wasn't your gold standard of randomized control trial.
Yeah, doing pregnancy anyway. No. Another study, a 2010 study, they did not find any increased risk of malformations in baby, but they did find an increased risk for some outcome measures like being low birth weight, having a preterm birth, being small for gestational age, or having a C-section. So the most recent study that I know of came out, a few months ago, right, as of this recording. That study, I did think it was relatively well done. They didn't also include the benzodiazepines in that study. But for the Z drugs, they found that there is an increased risk of the baby being small for gestational age if the Z drugs are taken early in pregnancy.
Yeah.
So there are increased risks with using these medications, but also to remember, insomnia is risky as well. So it's not like we cannot use these medications. Of course, if you're experiencing insomnia in pregnancy, you're in the majority. We usually recommend doing CBT for insomnia, but sometimes that's not right. So talk to your doctor now that you have the information about these risks, and also to note that the risks are not like astronomical, right? It's a small increased risk in these things. Yeah. Do you have anything you want to add?
No, I will just
Yes.
guess. No, but I will just yes. There are also other medications that can be used for insomnia and pregnancy that we do have more research on. So I think that's something to talk with your doctor about. If you're planning on getting pregnant, it might be worth trying out some different medications before you actually get pregnant to see if one of those other ones works better for you.
That's a great point. Really. That's good.
Thank you.
Thank you for being here. Please like, comment, subscribe. We'll see you soon.
Bye.